My name is Brad Norris. I am a massage therapist. I've been in the kind of sport performance world for almost 35 years. I really have a practice that kind of bridges the gap between performance and that therapeutic intervention. I taught for years for Charles Poliquin and the Fit Institute. I currently serve as the clinical educator for Rock Tape. So my goal in the kind of educational piece or educational space is to really kind of introduce therapists to the use of these tools and this toolbox that we have with Rock Tape. And that's been my kind of focus for the last 10 years. And I deal kind of practically in my practice with athletes and people of every age range and every injury possible. So it's been an eye-opening experience the last few years in COVID, because I've really just started to address a lot more patients outside of that athletic realm. So that's really my background. And again, it's really a performance kind of hybrid of performance and treatment in my case. And you can check anything that I'm doing currently on Instagram under the Movement Mojo. And you'll see great posts on both treatment and performance and conditioning, all the things that are really kind of key to my practice and the things I'm really passionate about.
My name's Ed Ratz. I'm a sport massage therapist. I've been at the University of Toronto for in practice now for close to 36 years. And my practice has been clinically dealing with all sorts of athletic injuries, and then at a performance end working with national team athletes, Olympic athletes, and professional athletes.
I'm Fabian Nardone. I'm a certified athletic therapist and on my way to finishing my massage therapy certification. I do not have the same amount of experience as these two gentlemen beside me, but kind of just coming in here and seeing what they got to say and try to give my input on some stuff. I was a former Division I AA athlete, and trying to use my experience with that coming into the athletic therapy world and trying to make relationships with my athletes and go from there. You can email me at fabiannardone@hotmail.com. I do a lot of private care on the side as well.
The idea that does being a better athlete make you a better therapist? Or being an athlete make you a better therapist? I would argue, again, we work in a sport environment, so I deal primarily with hockey and football and rugby players. You guys deal in a sport environment. But I would still argue that being an athlete really gave me a sense of kind of understanding conditioning, understanding motor control and function and how to train and what to do. I think it only complements my practice. And I also think it gives me a better sense of how to treat athletes. Mm-hmm. I have a better relationship with athletes because I know
what they're going through.
What happened. I mean, I can tell you the story. I was on the bobsled team from 85 until 88, and after the Olympics, I retired. But I had numerous concussions. I had a ton of accidents and tons of injuries. And this is not to take away from our therapy, the team that we had as therapists. They were fantastic. But it was the 80s. And I remember
you
leaving.
Had a poor driver.
Yeah, I had a driver that wasn't as good as he should have been. But the stark reality was that I left that frustrated as hell, and I wanted to learn more, and I wanted to do more as a strength and conditioning coach or a therapist or whatever. And so I think being an athlete, I think it motivates you to see things a little differently. Mm-hmm. I think you have a better sense of what real good movement feels like and what it should look like. And I also think you'll have a much better relationship with those patients you have who are athletes. And you'll have again, when an athlete comes in my office, my discussions with them, I don't know about you guys, are uniquely different than I have with a private client who's, in their 50s and they have a lower back injury. Yep. So I really do believe that maybe that athletic experience might feed in very well to what we do practically as therapists.
I find that being an athlete 1000% makes me a better therapist. Like, for an example, because my friends are going to give me shit for this because I talk about it a lot, but I've had 2 ACL reconstructions on my right knee from playing football, back to back. And I find that going through the rehab of my own injury, even well before I even started finding athletic therapy and massage therapy, it allowed me to know exactly where to go, what to treat, how it feels in specific areas, like what concerns you have. So right now I have, I think, maybe 10 ACL patients on my caseload, and they're all at different stages, different types of athleticism, different sports, and it just allows me to kind of fine tune and tailor individually like what they specifically need, because I know from firsthand experience how it feels, what to feel, like what concerns that they have. Like even like one of my new patients, he's like a recreational soccer player, and 18-year-old mom comes in and was like, I'm so glad that you're treating my son because you have the experience. He was talking about that, like he trusts you because you've been there, you know what to expect, and then it allows that relationship to build. And I'm very big on building relationships with your patients because it gives you a way better idea of what to do.
The big thing is understanding the psyche.
Yeah.
Like for me, knowing the sport, knowing the athlete, but understanding as a former athlete, I really get it when somebody's in a competition and they can't compete.
Mm-hmm.
I get it in their training and they're left away from the rest of the group. I try to get my athletes back into the group. Even if they can't be there, I want them involved with the team on some kind of level. Because once they've taken out of that situation, like it's a big part of who they are. You don't realize it like until you were an athlete at one time and you step away from that. Like all of a sudden a big part of your life is absent.
Big void.
And so it's a big void. So I find it's just, and it's also like there are times where something comes up in a conversation, you're with an athletic, and somebody will ask you, oh Ed, what kind of sports do you do? And then you'll have a conversation about that, and they're really shocked of different things that you did, and
Yep.
they're kind of interested about hearing it, and it's another way to kind of bond with your patient just based on those experiences. I did try to do all 10 events.
Oh, in decathlon.
I was scared as shit. The pole vault I just could not do. I was just like, no, I'm not doing any more of this.
It was, but that was as demanding as it gets. I mean, I left decathlon when I was at U of T to go to bobsledding with the Canadian team. But again, I mean, therapeutically, I think it gives me, again, more sports. I think I have just a better sense of how to treat and manage athletes, and I have a better connection with them knowing that I've had some of the experience.
Having done that
had.
sport, don't you because I know my experience working with multi-event athletes, it just forced me to look at movement right from the get-go.
No doubt about it. I think track and field is the most powerful kind of reference, because it really is the most primal expectation: run, jump, throw. Like, come on.
Yeah.
So I think when you have track athletes, I always argue, and this is probably biased on my part because I was a track athlete, but track athletes have more intuition than most other athletes. I find track athletes are incredibly intuitive about their bodies.
100%.
They have to be. They have to listen to their bodies because they are pushing themselves completely at 100%. There are other sporting, and it doesn't say basketball, soccer, that people aren't pushing themselves, but you can be 90% and still play that sport.
Yeah,
you can't be 90% in track.
Always have to be 100.
Like it's
some of the best therapists I've worked with are former track athletes. Seriously, I mean, so that might in and of itself answer the question.
Yeah,
it tells you a lot about the experience. Does it mean that every therapist that didn't have this very, colored kind of wonderfully crazy sport background is going to be lacking as a therapist? Absolutely not. But I think there's some suggestion for us as therapists to think that having that experience will probably give you a more intuitive framework about your practice and how you're going to treat athletes.
You can grasp things a lot easier with that knowledge. You can understand what movements need to be done, how to do them a little bit more detailed oriented wise, right?
I agree. I think you nailed it.
You can teach someone how to do a squat who's never done anything, but then if you're an Olympic athlete, like you're an Olympic lifter, you know a lot about squatting.
Easy.
So you can do a lot of detailed, cues to make them understand how to do it and just make them better.
Yeah, I agree. I think that's the perfect kind of synopsis of where we are.
I was treating a multi-event athlete. She had a rib problem, and it only happens when I do my cleans. So we went downstairs, showed me her cleans. I said, no, you just have to tuck your elbow under. Rib problem
That's
resolved.
all. That's all it may take, right?
Right.
Little movements.
So
perfect.
Yeah.